What are the right habits and mindset for treating scoliosis? The term lifestyle refers to a person's daily routine and how it's aligned that routine is with healthy habits that promote health and healing. A scoliosis-friendly lifestyle means staying strong, flexible, and active. And maintaining mental health is important for everyone. But for those dealing with an additional challenge like living with a progressive spinal condition like scoliosis, a healthy mindset can be particularly beneficial, especially in overcoming and reducing the size of curvature that they have. When we look at treatment plans for scoliosis, we know every single treatment plan is case specific. But unfortunately, the majority of them tend to be lengthy and at times can be quite intense. So therefore, having a positive attitude and how we can actually focus on improving their condition can have a very important aspect when we look at how they have to follow through their entire course of treatment, especially when times become challenging. Once results are evident, once we start seeing changes, very often these results can be motivating them themselves. But normally we need a particular amount of commitment and time in order to get there. So the first 3 to 6 months can sometimes be challenging for patients because enough time hasn't set in to actually start seeing the changes to occur. And in addition, since the treatments can be lengthy, even though they're seeing positive results, it can be difficult for any patient to commit with any type of program that can sometimes take a year, 18 months, or even 2 years. So training the mind to look at the scoliosis as something that you have to overcome as opposed to a disability that's going to limit you and affect you for the rest of your life is very important. And this type of healthy mindset can not only trickle into the treatment of the scoliosis, but can trickle into many areas of the person's life and give them a sense of overcoming, where now they become an overcomer as opposed to I've been affected or a victim in some manner. So when we look at scoliosis, we look at many importance of their lifestyle. And one thing obviously is diet. When we look at diet, we know patients that have a balanced, healthy diet tend to have healthier mindsets regarding their overall body. They feel better and they have more energy. And we know a healthy, high energy diet means they'll be better to handle scoliosis and the rigors associated with the treatment. Also, patients that have an anti-inflammatory diet, especially adults, can have less pain and discomfort as a result of the scoliosis and potentially even less in pain or discomfort associated with any type of treatment. So we recommend this type of treatment with patients with scoliosis, especially for adults that are experiencing pain. We also know patients that have a healthy diet tend to maintain a better weight profile. And we know patients with better weight profile is better for patients with scoliosis because the individual parts of the spine and the body aren't being strained as much as patients with heavier weight profiles as a result of the unbalance or curvature that occurs in the spine. And therefore, we look at healthy diets as being a balanced diet that's focused on anti-inflammatory types of foods to help promote healthy weight and flexibility and tissue design. Now, when we also look at exercise or movement, that we know the spine has a movement-based approach, that the spine needs to be flexible. It needs to move. It needs to have the ability to circulate nutrients throughout the spinal tissues for better repair, for intervertebral discs, for the ligaments and the tendons. So spinal mobility and motion is important for scoliosis treatment. So we know regular exercise is something that's needed for a spine and the muscles around it to stay strong. And in fact, dealing with this increased muscle strength is one facet of scoliosis treatment, because the stronger the person is, the more they can participate in their scoliosis treatment. However, being strong alone doesn't stop scoliosis progression. So we can see patients that are very fit, but their curve is still worsening. So fitness doesn't mean stopping curve progression, but fitness does mean that we can use your own body strength to help us in the scoliosis treatment. So this surrounded tissue that providing support to the spine can be used in a way to help improve your position of your scoliosis. And also patients that exercise, like patients that have healthy diets, tend to have more healthy body weight. And this, again, we know helps patients with scoliosis because we know the leaner the patient is, not only they're putting less pressure on their spine, but they also respond better to any type of physical approaches to the scoliosis because they have to push through less mass of the body to get to the spine. So we know patients with scoliosis benefit from these two things: healthy diet, healthy exercise programs, but they also benefit from having a very having a positive support social structure. And this is one that's full of positivity, encouragement, and they can have lots of impact on how a person approaches scoliosis treatment. I can have patients that have the exact same curve type, be the exact same age, and one person excels through the treatment and the other person has a very hard time doing it. And it's normally nothing physical. It's all about how they perceive the treatment, how they adapt to the treatment, and how their social structure encompasses them treating their scoliosis. And we know patients with scoliosis can suffer from a negative self-image because unfortunately scoliosis not only affects what we see inside, but it also affects what we see outside. And younger patients can have a harder time of accepting this different look, the way they feel and the way they look relative to their peers. So having a support structure and friends that don't make them feel different or look different, and they can just fit in with their friends and peers, we know this will have a much better impact on their scoliosis treatment, and more likely they're going to have a more positive outcome. So adolescents just really want to blend in. And unfortunately, like we know, scoliosis can make them look different, make them walk different, make them feel different. Sometimes they can have pain, or sometimes they can't do all the things that other kids can do. And this is why we know that a lot of times adolescents won't share these things with their parents, and they're more likely to share them with their friends. So having some trusted individuals in an adolescent's life that they can confide with and talk to about what they're feeling is an important concern when we're treating with scoliosis. Here at Scoliosis Reduction Center, we really treat the whole patient. We're not just looking at the spine and just trying to make the spine as straight as possible. We're trying to make the body function as best as we possibly can. This looks at exercise, we look at diet, we look at emotional stability and health. And the idea here is to balance the importance of having a straighter spine so they can be physically and mentally supported properly. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.